This week on Health and Living Talk Show, we chat with Brenda Madondo, a cervical cancer specialist from the Generational Changes Girls. She tells us more about cervical cancer from the causes, stages, and forms of treatment.
I was on my way to cervical screening. Not exactly something you look forward to.
At first I didn't think I needed to do this.
I was worried it would be really embarrassing, but my friend said it's really important. It can prevent cancer.
And my girlfriend said she'd come with me, so I thought, let's do it.
When I got there, I was nervous, but the nurse was really nice. She does these tests all the time.
I had to take my jeans and pants off and lay down on the bed with my knees up and my legs open.
The nurse put something called a speculum into my vagina to help her see the cervix, and used a small soft brush to take the sample.
I thought it might hurt, but actually, it was only a bit uncomfortable.
That's it, all done. Are you okay?
It was all over in a few minutes, and then I went back to work. They'll send me a letter with the results.
And if they do find abnormal cells, they can be treated to stop cervical cancer from developing in the first place, which is definitely worth it. I'm not scared of it now.
So I'll do it again in 3 years and won't even worry about it.
If you're not sure that you need to, just think,
if you've got a cervix, then cervical screening is for you.
It saves lives.
Welcome to Health and Living. Today we're going to be talking about one of the diseases that is the leading cause of death in Zimbabwe. And joining me today is a cervical cancer specialist who's going to help me talk about this disease. Can you please introduce yourself?
Hello, my name is Brenda Madondo, and I'm the co-founder of Generational Changes Girls.
Okay, thank you. Can you tell us more about Generational Changes Girls? What is it all about?
Okay, Generational Changes Girls, it's an organization that empowers young single ladies to have a successful single life. And our core vision is to eradicate cervical cancer by 2057.
Okay. I've heard about a term called VIAC.
Yes.
Can you please tell me more about it? Screening through VIAC. What is it about?
Okay, so VIAC basically is it's an abbreviation. V for visual, and I for the inspection, and the A for the acetic acid, and the C for the cervical graph. So what the V stands for is we're going to be visualizing the cervix. The cervix is actually the mouth of the uterus or the mouth of the womb, and we're going to inspect around it to see if there are any abnormalities, and then we're going to use a solution that we call acetic acid so that we can see any precancerous lesions. By precancerous lesions, we're talking about amazai or amaqanda, or the eggs that hatch into cancer. Okay. And then the C is the cervical graph, where we're going to take a picture so that you can actually appreciate your results.
Okay. What causes cervical cancer?
Cervical cancer is caused by a virus called HPV, or human papilloma virus, and it is sexually transmitted. And but there are other predisposing factors that leads to cervical cancer. For example, if you're looking at having early sexual intercourse, and since we say that this is a sexually transmitted infection, so if someone starts having sex at a very young age, they have more risks of getting the virus, because from the young age up until maybe the time they get married, they'll have met so many sexual partners. And also, even if you are having so many sexual partners, these days people can have so many sexual partners, and they've got sexual partners for different things. We like to call them ministers, girls have got these funny terms. Yes. They want minister of finance, yes. This person is going to bring them money. They want minister of tourism, the person that is going to take them to Vic Falls, minister of home affairs, the one that stays at home. So you're looking at all these ministers, they might be having sex with you. So you're going to predispose yourself to having cervical cancer or having the HPV. We're looking at a person that is faithful, but has got a guy that has got so many sexual partners. Remember, we are saying this is sexually transmitted. So if someone is having so many sexual partners, there are so many chances that this guy will bring HPV or the human papilloma virus to the lady. We also look at maybe using of herbs. Girls or women, they love to use herbs. Love charms. They put different things in there.
Yes,
They put,
groceries.
they can actually put insects. They put a baboon's urine. They put a lot of things. They say
Yeah.
that it makes the guy to come back home. It makes the husband to stay at home. And these things, they predispose them to a lot of to the infection. Then inserting fingers when you are bathing,
bathing, yes.
the douching, and we always say that the female's organ or the vagina was designed to cleanse itself.
Yes.
So when you use your fingers by bathing, you're going to scratch yourself, and when you scratch yourself, the virus can get in, and when it gets in, you've got so many chances of getting the cervical cancer.
And is this screening or test painful?
Well, people have got that assumption, but it's not painful. We're going to use an instrument that is called a speculum, and it's quite small. However, or maybe let me say rather, the vagina can actually stretch. Remember, a baby can come out. And we're going to use an instrument that is quite small. So painful, it's not painful, not
Okay.
at all.
Okay, after the screening, what results can one expect?
Okay, so when you come for VIAC, there are probably 3 results that you can look forward to. Number 1, when you can have a VIAC negative, means that you are okay, you don't have any precancerous lesions, or you can have positive results, meaning that you've got precancerous lesions, the ones that we say the eggs that hatch into cancer, or you can have what we call suspicious of cancer, where we're saying we are thinking that you've already developed the cancer.
Yes.
So expect these 3 results.
Okay. So will this test actually tell you that you've got cervical cancer or any other non-cancerous conditions?
Well, yes. That's the good thing about VIAC. You can actually see other infections, like maybe probably you don't have the cervical cancer,
Yes.
but you've got what we've called a cervicitis, which is just an infection on the cervix, or you've got an abnormal discharge, or you've got maybe warts. So with the VIAC, you can actually see other conditions that are not cancer related. So it's like killing many birds with one stone.
Okay.
Yes.
And what are the types of treatments that you can get after you've maybe gotten a positive
result?
Yes.
Okay, so it depends with the type. It depends with the types of the lesions that we have. We can do a freezing method that is called cryotherapy, where we're going to freeze the lesions and then they die. We can do a heating method, or we can actually do what we call LEAP, where we're going to scrape off the precancerous lesions. We send them for histology. The histology results are going to tell us whether we've removed everything. So you expect the precancerous lesion to be frozen, to be heated, or to be scraped off.
Okay.
Or you can actually remove the whole uterus. When we think that this precancerous lesion, there are too many, we might miss some of them. We might actually remove the whole uterus, especially for people that have finished their childbearing.
Okay.
Yes.
Cervical cancer is usually related to HIV. Can the screening detect STIs?
Yes. This screening can detect STIs. Some of them. Like I said, maybe if you do the screening, you can have some abnormal discharge, or you can see that the nature of the cervix can tell you that this person has got infection. And with the HIV-related part, remember we said that as a woman, your own immune system can fight the virus, right? But if you're HIV positive, already your immune system or your soldiers of the body are already compromised. They've got another infection that the soldiers are trying to fight. So if a person is HIV positive, it's one of the risk factors that they might be very susceptible to getting the HPV, the human papilloma virus, easily.
Okay. And going back to the previous question, how effective are those treatments?
They are very, very effective, because we say when you get the treatment, we don't just send you home. We say when you are done with the treatment, we've got follow-up visits. We've got 2 screening follow-up visits that we do, so that we make sure that we have removed the cancer, the precancerous lesions.
Okay.
Yes.
And for young people, they have got this fear of screening. Sometimes I feel that if maybe I don't have a child yet, and I do I go for VIAC and I get tested positive, what happens? Will I ever be able to have children after the screening and the treatment?
Okay. Yes, you will have your children, because when we do the treatment, the cervix usually gets back to its original state.
Once you get a positive result, it means that you've been promiscuous.
Yes, you know that's what they used to say about HIV. They're also saying it about HPV, but it's not really the case. Remember, we say that you could be faithful, and having a partner that is has had so many sexual partners. When we say that you've had so many sexual partners, we're not saying that you're promiscuous. Maybe you're looking for love, and you're saying from one person to another, or maybe you've got other things that have accelerated you to have the cervical cancer. Like you said, maybe you're using herbs, or maybe your immune system is weak. Maybe you've got other condition that is causing your soldiers to go down. So having cervical cancer, it's not always being promiscuous, but being promiscuous also is a high risk of having cervical cancer.
It can lead to cervical cancer.
Yes.
Yes, and we've been raised to believe in what you just said, using herbs. You're told you must put herbs so that you'd be nice in bed and all that.
Yes.
And young girls are being taught that at a very young age. This misconception has increased the cases of cervical cancer.
Yes.
What programs have been put to help young girls to actually know about cervical cancer and to help them to be able to take precautions and prevent themselves from getting cervical cancer?
Okay, yeah, I'm glad that people are getting educated, they're getting empowered. Like we said, from generational changes, girls, our core business is empowering young ladies, those that are in colleges and schools. So we go there, we do health education, and when we do health education, we involve the men. We ask these men, you guys, do you even appreciate that someone has put something? And they always say, no, we don't actually know that you put things. So we want to, when we do this education, my encouragement is don't leave out the men. Because when the men speak, you actually get to understand that we are just fooling ourselves. Yes. They don't even understand. They don't even know about these herbs.
That we're actually doing all these things.
Yes, it's psychological. So what we're doing is generational changes, girls. We're going into colleges, going into high schools. We're educating them. We're empowering them. We're trying to find out how best we can screen them, because sometimes they are shy to come to the public hospital. I remember this girl, she said, I met my mindfulness there and I just couldn't get screened. One person will tell you, I met my mother there. So we are trying to get ways in which we can screen them separately. But for now, we are doing a vast education to teach them about these predisposing factors to cervical cancer.
Yes, which actually empowers the young girls.
Yes.
And like you said, those girls meet Mamfundisi and their mothers. They now feel like cervical cancer is only for older women. They actually can't contract cervical cancer. Can cervical cancer be prevented, or is it a death sentence?
It's not a death sentence. One thing I like about cervical cancer is it's one of the few or rare cancers that we know the causative organism. Yes. Most of the cancers we don't know where they'll be coming from. But with cervical cancer, we know that it's coming from the HPV. We know that it's sexually transmitted. So if we know that, we know how to prevent it. Yes. So yes, it can be prevented. It's very possible that a person can live a lifetime knowing that I'm not going to have cervical cancer. Because if you stick to your stipulated review dates, if you come every year if you're HIV positive, if you come every 3 years if you are HIV negative, remember we said if you have got precancerous lesion, we can treat them. So it's very possible that you can have precancerous lesion and not get to cancer. So it's not a death sentence.
Okay. And what are the programs that have been put in place to help prevent cervical cancer?
So with cervical cancer is the education. We are doing as much health education because we say prevention is cheaper than cure. So we need to empower ladies about the preventive measures that are in place. And remember, in government hospitals, cervical cancer screening is for free.
Yes.
The government has helped us, it's for free. And the treatment modalities, there are donor people that are coming in play. They are helping the mothers to fund some treatment modalities. So all over, we're going to churches, corporate functions, we are talking about cervical cancer because we believe, like we said, as general changes girls, our main goal is we want cervical cancer to be eradicated by 2057. It looks like it's far, but we believe that if we know the cause, we can actually beat it.
Yes.
So most of the programs that are in play is just health education.
Okay.
Yes.
And where can people get screening services, mostly around Bulawayo?
Okay. In Bulawayo, all government major hospitals like Central Hospital, Mpilo, United Blair Hospital, they're offering screening for free. And all city clinics, we've got EF Watson in Popoma, we've got Luveve Clinic, we've got Nkulumani Clinic, and in town we've got Bambanani Center, that is the New Start Center.
Okay.
They're offering for free. And we know there are busy women out there that can't afford to go to government hospital. Most gynecologists, doctors, they are offering these services, they're private. And I know it's a small fee, but like we said, prevention is cheaper than cure.
How will this treatment affect my daily life?
Okay, it doesn't affect much. When you come for the treatment, whether you're coming for the freezing or for the heating, you get the treatment there and you go back home that very same day. There's no admission, and it's an outpatient procedure where you come in, you go back home. However, in each and every treatment, you're going to abstain from sexual intercourse for 6 weeks.
6 weeks, okay.
Yes.
Yes, that's
So you
direct.
go on an emergency holiday.
Okay, and are there any VIAC centers in rural areas?
Yes. Actually, there are so many VIAC centers in district hospitals. We are trying to cover as much ground as possible because we don't want to have the people from the rural areas to have a disadvantage, or we don't want them to be spending lots of money to come for the screening in big towns. So VIAC is being decentralized. So in almost every district hospital, you can find a VIAC clinic.
Okay, and how is VIAC different from pap smear?
VIAC and pap smear, this is just two different methods aiming for one goal. So at the end of the day, we are not fighting. We are aiming to achieve one goal. So pap smear is also screening for cervical cancer. VIAC, we're also screening for cervical cancer. The other method is cheaper than the other method. They've got, they are different, but at the same time, they're achieving one goal. Okay. So if you have a pap smear, you still have okay. If you have VIAC done, it's still okay.
Okay, so pap smear is just another method of screening.
Yes.
Okay. And what other services can one get at a VIAC center?
So when you come for VIAC, besides getting the cervical cancer screening, we screen also for breast cancer. It's a total package. You have your breast cancer screening, you have your cervical cancer screening, and sometimes we can screen for sexually transmitted infections. Then you've got your HIV counseling and testing.
Okay.
All in one package.
All right.
Yes.
What happens to someone who comes in for screening at a later stage and they already have cervical cancer?
Okay. Officially, I don't really wish something like that to happen to anyone. But in case someone comes late, well, you will have to do what we call a punch biopsy. like I said, when you do cervical cancer screening, you're expecting 3 results: the negative, the positive, and the suspicious of cancer. We are not the ones who are going to tell you you've got cancer. We're going to do further investigations. But based on our training, we can tell that. That's why we're saying we are suspecting that you've got cancer. So what we do, we're going to do in a further investigation that is called punch biopsy, where the pathologist is going to detect whether the person has got cancer. And when you detect that you've got cancer, we are going to grade the cancer. And after that, from our side, there's nothing much that we can do for you. We are going to send you to the oncologist, where you're going to have your radiotherapies, you're going to have your chemotherapies, brachytherapy, which is very expensive. And it's very difficult the treatment is quite difficult. It's a challenge in Zimbabwe, because there are few centers that are catering for those services. That's why we say prevention is cheaper than cure. You'd rather come to be screened than to wait to get to a late stage.
Okay, so early detection is actually key.
Early detection is actually key when you come. If you are considered also to be VIH positive, I know some people might want to go and look for non-medical help, and we really discourage that, because it's not yet scientifically proven that it can really help you. I know there's still research going on, but I'd rather you come and get the medical aspect and probably use the non-medical aspect, so that you get help as fast as possible. So when people say, please go and get this type of treatment done, I'd rather people really comply to that. Get educated, get empowered, that these people have gone into length to scientifically prove that this can work.
Yes.
Yes.
So we can safely say that the only method that has been effective for cancer treatment, it's the medical ones, radiotherapy, chemo, and therapy.
Yes. Okay. We don't dispute what other people are doing, but we say for now, we would rather deal with the things that are scientifically proven.
Yes.
Yes.
Okay. It's very true. And this talk has been very informative. What would you say to encourage young girls who are watching this?
Young girls, if you're sexually active, go and get screened as soon as possible, because according to our research, we used to think that cancer is for older people.
Yes.
But remember, we said this is a sexually transmitted infection. So if you are having sex, it means you are at risk of having the cancer. Whether you are 19, whether you are 17, you should come and have the screening.
Yes.
Yes.
Thank you so much for joining us, sister.
My pleasure.
Okay. Thank you for watching, guys, and remember, early detection is key to successfully treating any forms of cancer. So don't forget to go and get screened at the mentioned VX centers. For now, it's goodbye, and remember to stay in shape.